and thanks for sitting along with me today. My name is Dr. Meredith Watkins, and this is 360 RN. This video is part of the Mental Health Nursing series, giving you all of the need-to-know information that you need for mental health, both for beginner bedside practice as well as to pass your NCLEX. Make sure you grab the Mental Health Study Buddy workbooking system. It's in the description box below, and it'll help you get the most out of these lessons. Today we're talking about the importance of therapeutic rapport and therapeutic communication in mental health nursing. We've got a lot of ground to cover in a very short video, so we're going to be talking about the purpose of a therapeutic relationship, identifying therapeutic versus non-therapeutic communication, explaining therapeutic use of self, talking about holistic nursing practices in mental health nursing, describe the 4 phases of a nurse-patient relationship, talk about how to build trust and rapport with the patient, give you some tools on communication techniques, and how to use interviewing techniques to help encourage patients to reach their goals. It's a lot of ground to cover, but I know we're up to it. The purpose of a therapeutic relationship is to help the client meet their health goals. And we do that by promoting a positive nurse-client relationship. And a positive nurse-client relationship facilitates healing, adherence to treatment recommendations, helps the patients to understand the teaching that we provide, and it provides the patient an ability to express themselves and explore their own thoughts. According to Peplau's theory of interpersonal relationships, there's 4 phases of the nurse-client relationship. And these are orientation, identification, exploitation, and resolution. In the orientation phase, this is when you get to know the client, you introduce yourself, maybe look at their chart, and set expectations for how you're going to help them and what the nurse-client relationship looks like. In the identification phase, this is when you work with the client to identify what their wellness goals are, identify their needs, and also address any barriers that they have to achieving their goals. In the exploitation phase, which is also known as the working phase, this is when you get to work. You partner with the client to help them achieve the goals that they've set forward. In the resolution phase, the goals for the client have been met. And at this point, you may wrap up the relationship with the patient because it is a goal-centered relationship. You might need to identify new goals. And also help the patient plan for the future, whether that is a future goal that you're going to help them with or a referral that you'll make to another healthcare provider. Building trust and rapport with your client will help them to adhere to treatment and trust you when you give them teaching and education about their illness and about their adherence to treatment. Recognize that patients have previous healthcare experiences that may have not been very positive, and they bring those relationships and those experiences into this new working relationship with you. And so if the patient is standoffish, disbelieving, not trusting, it may not be because of something you are doing, but how you have to repair previous experiences in order to establish that trust and rapport. Ways to build trust with your patients include providing culturally competent care, providing honesty, being empathetic, and being respectful. When we're talking about therapeutic communication and building rapport with the patient, we want to remember to take a holistic approach to patient care, recognizing the client as an integrated being of mind, body, and spirit. This includes their emotions, their thinking, their psychosocial needs, their physical needs, and their spiritual needs. Therapeutic communication is different than everyday communication. This communication is goal-driven and client-focused. It helps to strengthen the therapeutic relationship, and it's characterized by things like empathy and respect. I'm going to tell you some therapeutic communication techniques, both nonverbal and verbal, to help you build that therapeutic relationship with your patients. Now, nonverbal examples of therapeutic communication include the way that you position yourself to face the client. Facing the client shows that you're actively engaged and interested in listening to what they have to say. Sitting down with the client. Did you know that patients perceive that we spend more time with them if we sit down with them, even if it's the same amount of time than if we had been standing? So just sitting down, being at the client's eye level can really help foster that therapeutic relationship. Have an open posture. An open posture means being present, having your shoulders squared toward the patient, having an open position with your arms. A closed off posture, on the other hand, would be if I'm having my shoulder kind of away from you, looking away, closing my arms off. You can see that this is just an uninterested position. We want to be actively open to the patient. And finally, be unhurried. We know that you've got a million things to do, but if the client senses that, they're not going to be open to talking to you as much. When we communicate with a client using therapeutic communication, the goal is to allow the client to explore their thoughts, feelings, and processes as they're on their healing journey. I'm not a gymnast, but you know in gymnastics, when they have that long runway and they run, and then they jump on a springboard, and they jump over the vault, and then they hurl up in the air, and then they land, and they do the really cool landing, and everyone claps, right? I don't know. I'm sure if you're a gymnast, there's much better ways to explain it. But I want you to imagine yourself as you are the springboard before the vault. So the patient is running, and then you are the springboard to help them process things so that they can do all these cool flips and turns and ideas as they go over the vault and land and have a fantastic landing. And so what I mean by that is that you want to use communication techniques that help the patient to further explore and express their thoughts and feelings. And one way to do that is using open-ended questions. So if you ask questions that end with yes or no, that's a closed-ended question. And if you have teenagers at home, you'll know what I'm talking about. How was your day? Good. How are you feeling? Fine. If you can answer the question with one word, it's not an open-ended question. One way to help yourself is to say, tell me more about that. You want to make sure that you are actively listening to what the patient's saying, responding to what they're saying, showing that you're interested in what they have to say. Another thing to do is restate, clarify, or validate message. So you could say, the patient says, I'm really lonely because my wife passed away last year. And you could literally restate back to them, you're feeling lonely because your wife died? And then the patient could say, yeah, and here's why. Validating messages. So what I'm hearing you say is, right, that's validating messages. Interpreting body language and sharing observations. So you come in the room and the patient's crossing their arms and looking down at the floor. You could say, I notice your arms are crossed and you're looking down at the floor. You seem troubled. Tell me what's going on. Explore issues. That's when you say, tell me more about that, when something that a client brings up. Summarizing is when you summarize the key points of the conversation. That way the patient knows that you were listening. Paraphrase is restating something in the patient's words. And then finally is the therapeutic use of silence. Silence can be very uncomfortable, but when we're with a patient, sometimes using silence for a few seconds will make the patient process things in their own head and then start talking again. And that's a really beautiful process. So don't be afraid of using some moments of silence. Now, silence can be used inappropriately. If the patient says something very sensitive, or maybe that they're sharing something with you that they've never shared with people before, and you're silent, it might be seen as judgment. So be careful on your use of silence, but it can be a great therapeutic tool. Now, there are also some things that we can do that are non-therapeutic. These are breakdowns to therapeutic communication. They will shut the communication down. Fire hosing information, giving information too much all at once where the patient can't contain it all. Do you ever feel like that in nursing school, perhaps? Providing false assurance. Sometimes not everything is going to be okay, and you can't always guarantee that everything's going to be okay. It's human nature to want to tell people that, but don't provide false hope. Stereotyping. Don't lock people into a box. Allow them to express themselves, give themselves their own labels if they choose, or not, but don't assume things about people. Don't use patronizing language like sweetie or honey. Avoid asking why. The word why can feel very judgmental for patients. And this is a key for NCLEX questions, because if you see something that has why did you do that as one of the options, it'll almost always be wrong. Why is not a good thing to say when you're talking about therapeutic communication. We want to avoid changing the subject inappropriately. If the patients are in the middle of a stream of thought and all of a sudden we switch it to something else, it doesn't show that we're active listening or following along with their goals. We want to avoid expressing approval or disapproval, because if you start expressing approval over a lot of things, it means you're also, when you avoid expressing that approval, the patient could feel judged. So we're going to try to stay very neutral. And then lastly, we're going to avoid giving advice. Now, patient teaching on treatment recommendations is different, but saying, well, if I was in your situation, here's what I would do, is not therapeutic. So if you get admitted to the hospital for pneumonia and they give you IV antibiotics to help you heal, those IV antibiotics are going to help you heal whether you are participating in the healing process yourself or not. But mental health healing is different. It's important that the client is the one taking the steps to produce the healing. They have to be actively participating and guiding their own healing in mental health. And so in order to help the patients along that process, we can help motivate the clients to make change through a few techniques. The first is to help the client identify their mental health goals so that they have a goal and we can help them meet it. The second is to stay neutral. It's not our job to judge or to tell them whether their goal is good or bad. We are just there to provide support. The third tactic is to ask open-ended questions. This goes right back to that therapeutic communication. So things like, tell me more about your thoughts on, or what might be the consequences for blank, and allow the patient to explore those thoughts themselves rather than just being told what to do. The fourth suggestion is to help the patient set SMART goals. SMART goals are ones that are very specific, that they can be measured, that they are achievable and realistic, and that they have time-bound parameters, that in the next 3 months or in the next 1 week or today my goal is. And when you set a SMART goal, it's specific, it's easy to follow and track whether the patient has met it and any changes that need to be made. And finally, help the client to identify health-promoting changes. This could be how to adhere to their treatment regime better, medications, or behavioral modifications. That's going to wrap it up for this lecture on therapeutic communications and building relationships. Thank you so much for studying with me today. And remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.